We often get confused between the two terms, mental illness and mental disturbance. In our day-to-day series of life, we all can get stressed. We may feel mentally disturbed, but that does not mean it is some mental illness. A mental disorder is diagnosed after a complex criteria of diagnostic evaluation, and according to DSM-5 criteria for mental disease, a group of brain disorder that cause extreme fluctuations in person's mood, energy, and ability to function is called as bipolar disorder. Bipolar disorder has the risk factors as stressful life, family history of bipolar disorder, loss of a loved one, substance abuse, brain chemical and neurological issues. Acetylcholine and GABA, these two neurotransmitters play a vital role in the balance of many neurological functions. An imbalance in these neurotransmitters can lead to the disorders like bipolar disorders. If we talk about the triggers in bipolar disorder, then they are insufficient amount of sleep, altercation with loved ones, alcohol, smoking and substance abuse, certain antidepressants for different problems, pregnancy and hormonal conditions, change in the season, or we can say seasonal disorders. If we talk about the clinical features, then people with bipolar disorder experience unusual intense emotional state that occurs in distinct periods called as mood episodes, or joyful or overexcited state called as manic episode, extreme sad or hopeless state called as depressive episode. Sometimes there is mood of both mania and depression called as mixed state. These states can be in the form of hypomania to hypermania, severe depression to mild low mood changes. If we categorize the symptoms, then there can be two modes by which we can judge a person is having bipolar disorder: mood change and behavior change. In mood change, there can be mania to depression. A person may feel high or joy for a longer period of time and then turn it into the feeling of worried and emptiness. A person can be extremely irritable in mood and agitated and have feeling of weirdness, and on the other hand will lose interest in the activities once enjoyed by the person. If we will talk about the behavioral change, then the person having bipolar disorder talks very fast and jumps from one idea to the another, but on the other hand may feel tired and slowed down. A person having bipolar disorder is easily distracted and has low concentration. A person having bipolar disorder is restless and sleeps less. And there can be change in the eating habits like in the depressive person. A person having bipolar disorder is having unrealistic belief on self, and there can be behavioral impulsivity. But on the other hand, there can be suicidal thoughts in case of severe depression. A person suffering from bipolar disorder has two extreme types of mood with two extreme types of behaviors. These symptoms, clinical features, and episodes can judge and can help us to evaluate the person having bipolar disorder. For another part of this video, stay tuned to Nursing World channel and follow me on Instagram with the name of Nursing World 21. And if you are not yet a subscriber, please go
and click on the subscribe button. Thank you.